Before we move on to our wonderful guest we have this evening, just want to give you a quick update on the previous guest. Those who watched it will know all about this wonderful woman, and if you don't, you should watch the webinar. It really is quite inspirational. Caroline Pover, I interviewed, suffered a catastrophic reaction to the AstraZeneca jab, and in fact suffered a stroke about 9 hours after having had the jab. And since then, there has been a major legal action against the manufacturer AstraZeneca, and at the moment 75 claims are in, and we, if it's successful, could be talking about multi-million pounds worth of damages being paid. Of course, the rub is that the company won't pay it at all, and the government will be paying this because they've underwritten any damage claim against the vaccine manufacturers, as of course they always do. And just an aside, we've had a lot of headlines about all this, but as an aside, I think it's quite a tragic aside, Caroline set up a help support group for people who suffered from any COVID vaccine, I suppose. And she told me that actually on a regular basis, members of her group commit suicide because they are suffering so badly from adverse reactions that their life is impossible. And you know, it's a silent tragedy which never seems to get reported. But as I say, it is really worthwhile catching the webinar, and I urge you to do so as Caroline Pover, which segues rather nicely onto this evening's talk, because AstraZeneca tested the COVID vaccine on animals, and it was deemed to be safe. And of course, that is clearly the whole point of the work of Pandora Pound, who's our guest tonight. Pandora, welcome. Thank you for joining us. Pandora is the medical director, or research director rather, of Safer Medicines Trust. And she's just come out with an amazing book called Rat Trap, and the subtitle is The Capture of Medicine by Animal Research and How to Break Free. That's a pretty strong title. And the eagle-eyed amongst you will know that we have serialized them, or extracted from the book, which is in our November issue. So if you haven't read it, do so. Caroline, welcome. It's lovely to have you with us. I mean, I must confess, WDDTY reports on animal testing a bit too much. I must admit that. There's a lot of medical research that comes out, and it's all based upon findings of mice studies or what you will. And we often get called out about that and saying, well, you really shouldn't be doing that. And so I'd like to sort of talk about that in a moment. But just first, could you explain to us the role of Safer Medicines Trust and what the aims are?
Yeah, well, thanks very much, first of all, for inviting me to talk with you, Brian. Yes, so Safer Medicines Trust is a small UK-based patient safety charity, and it really, the focus is on trying to encourage the use of human biology-based development and testing of drugs rather than testing based on animals, because we think that will make medicines safer and more effective, because they'll be more direct, the testing is more directly relevant to the human situation, of course.
Okay. I mean, so is your argument a moral one at all, or is it purely a pragmatic one?
No, we talk about the human harms of animal testing rather than the harms that are inflicted on animals, because obviously those animal harms are well documented. But what we focus on at Safer Medicines is how animal research can actually harm humans, and that's by either being unable to ensure the safety of medicines, or in fact by not being able to generate safe and effective treatments for humans.
Okay. I mean, because just to explain, drug testing goes through 4 phases. The 4th phase is after it's been licensed, and so there's ongoing supposed safety tests going on once it's amongst the general population. But the 3 phases before that are very much lab-based, including animal testing, followed by small group of humans, maybe I'm getting this wrong, and then a slightly larger group, maybe as a placebo trial before it gets a full license. Now, I mean, it seems to be intrinsic to the whole drug approval process that animal testing takes place. And it sounds like it's a regulatory requirement that animal testings have to take place first. And, you know, obviously the argument is, well, we all accept that it's cruel, but it's a necessary cruelty in order to safeguard against the next phase where it will be tested on humans. So, I mean, how would you respond to that?
Well, first of all, you asked about, you know, whether it's a regulatory requirement. And as you mentioned, there are various phases to testing a drug. So at the beginning, there are, you know, the so-called preclinical phases, which always includes animal testing at the moment, but it may also include in vitro testing as well, or in silico. And at the early stages, animals are used to sort of explore safety and efficacy. But later on in that process, that specific sort of safety studies will be done. And you know, obviously, we generally think that animal tests ensure our safety, so we don't want to test on humans, so we use animals first. Now that would be a logical step if animal tests predicted human safety. The problem is, as we know, animal tests are not very good at predicting human safety. So they're kind of better at, you know, if an animal test shows that there is toxicity from a drug, then, you know, there is evidence that it will show toxicity in humans, although that relationship isn't very consistent or reliable. But if an animal test doesn't show anything, so an absence of toxicity, it's very bad at predicting whether there'll be an absence of toxicity in humans. So, you know, if a drug shows no problems in animals, it will very likely then go on to be tested in humans. But in fact, that's the first stage at which the actual tests take place, you know, because what we don't really know anything from that preceding animal test. And of course, we know that there are instances in which, in fact, the humans, you know, first in human trials are you know, they go very badly wrong.
Yeah, I mean, the extract we use from your book is just that. It was a catastrophic example of a very small clinical trial, I think about no more than 8 or 10 people. I mean, it was devastating what happened to them, and yet that had passed all the safety requirements at the animal stage.
Yeah.
I mean, how common is that, in fact, that a drug has a catastrophic effect on humans?
I think, you know, they're newsworthy instances, but they are not, you know, they don't happen frequently. Those trials, like the one at Northwick Park or the one in France. But what is less known is, you know, further down the line when drugs are tested in small samples of patients or in clinical trials. Obviously, if the animal tests have shown that this drug is safe and effective in animals, and then it's trialed in humans, you know, this is really the first time when you begin to see large numbers of humans taking the drugs. The first time that we really know what's going on with this drug. And of course, you know, there are many instances in the field of stroke where I used to work. There was so many drugs that had been found safe and effective in animals, but when they were then trialed in humans, they were shown to increase mortality. Awful adverse effects were found. And this whole class of neuroprotective drugs has never managed to find any treatments for human stroke, you know, not one. And this is despite decades of animal research trying to find neuroprotective drugs. So.
Yeah. And the safety net seems pretty flimsy, doesn't it? Because sometimes quite a dangerous drug actually makes it all the way through to full market use, and Vioxx being one example. But I mean, there are others, of course, and yet that seemed to pass all the tests. So, animal testing, is it purely to test safety, or is it to test effectiveness of the compound as well?
No, it is also to test the effectiveness.
Okay.
Definitely.
I mean, you know, putting words in your mouth a little bit. You're essentially saying, look, it's a completely useless stage. It tells you absolutely nothing. And you know, your book cites many examples of that with a lot of solid science to back up the claim. So that being the case, how on earth is it that it ever happened in the first place? Do you understand the history of this, how it all came about?
Well, you know, I think there have been sort of sporadic use of experiments on animals from, you know, maybe the 4th century BC, but
Yeah.
and then afterwards, but nothing really, you know, in terms of great numbers as far as we know. But when we sort of get to the sort of late 19th century, and particularly in France, um, there was this sort of enthusiasm for the experimental method because it was seen as very scientific. You know, it used statistics. We were able to use controlled experiments. It was in a laboratory, so it was seen as very scientific, and it was seized upon by physiologists who were keen to bring their profession up to a sort of level of a respectable level of, you know, so that it was seen more in the realms of physics and chemistry, you know, a proper science.
Yeah.
And also, you know, medicine was keen to adopt it as well because previously, you know, doctors hadn't had, you know, great respectability that they have now, or weren't accorded that sort of respect. They used to observe patients at the bedside and then, you know, make hypotheses based on that. But these physiologists, of whom Claude Bernard was a great exponent of this experimental method, they argued that, you know, rather than observing patients, it was much more scientific to sort of do an experiment on an animal and then extrapolate the results to humans. And it became very successful. And the numbers of animals began to increase. And then you go into the 20th century, and because of the world wars, animal use was again, you know, it began to increase because there was these experiments using chemical warfare and radiation and so on. And there were a number of social factors, like the growth of national institutes of medical research, which then began to use animals. And of course, whole industries then began to grow up around animal use, like supplying specially bred animals, you know, sort of standardized animals that were healthy and, you know, had particular qualities, and also people supplying housing and food and, you know, surgical equipment.
Yeah.
And so it began to become a big industry, really.
Yeah. I mean, but did anyone ever step back and say, hold on a minute, we're all doing this, but is it actually telling us what we need to know? Has anyone actually tested animal testing?
Well, this is the problem, you see. So around about the beginning of, well, the 20th century, so I became interested in this, you know, the evidence behind animal research. Because I was working at the time in a medical school where I was actually quite near to a laboratory and I could see animals coming in and out. It got me thinking, really. And so I went to look for the evidence because I was interested in human benefit of animal research, because of course that's how it's justified. And all I could find were these sort of very vague statements, you know, such as animal research has been directly or indirectly responsible for all the advances of, you know, 20th century, or, you know, it's a self-evident sort of successful approach. But there was no evidence, no evidence backing up these statements.
Actual evidence.
No, so we went to, along with sort of 4 other professors, I went to look at this issue, and we wrote a paper in the British Medical Journal saying, where is the evidence that animal research benefits humans, you know? For which we were vilified because, you know, that was a sacred cow. You can't really ask those questions. But after that, there was a lot more focus then on animal studies, and there was systematic reviews were done trying to look at the evidence. And what they found was that the animal studies have done very badly, and so it's very difficult to draw any strong conclusions as a result of them, because they didn't produce robust, reliable findings.
Right.
And so a lot of it was unusable.
Right.
So it did come under scrutiny then, but there has been no sort of robust evaluation of animal research and whether it benefits humans. There's just lots of little bits of evidence.
Extraordinary. Okay. Just before get another question and just say the floor will also open to all our viewers this evening who can ask their own questions. Molly, could you just quickly explain how people can put a question into Zoom in case they don't know?
Yeah, of course. So at the bottom of your screen, you'll see a little Q&A button. If you just press that, and then it will pop up with an option to submit your questions, and I'll ask them to Pandora.
Great. Thanks, Molly. So just go back to a thing I sort of mentioned in passing, which probably needs a bit more sort of digging through, was I said I thought it was a regulatory requirement of drug testing. Is that in fact the case?
It's a really tricky question, this. So
okay.
It is the case that our regulators and MHRA, they don't specifically ask for animal studies. There is a widespread perception that it's a regulatory requirement, but they do in fact say that they will take other evidence of a drug's efficacy and safety. The trouble is they're only used to the animal data. The guidelines convey the idea that in fact you should use animal studies, that it is the gold standard. And so because there's this kind of perception, and it's not clearly sort of outlined in the guidelines that you can use, non-animal methods, people just do tend to submit animal data. And so the regulators are familiar with that data, and they're less familiar with human-based data, and so less confident about it.
Right. And it may be hard. I suppose you said, well, look, we've not tested on animals. We've done it in the lab or cell lines, and I'm sure you're going to tell me lots of other ways it could be done. But we've not tested on any animals. Now we need to recruit 8 hearty young medical students to test the drug. And I suppose there's a feeling, well, actually, would rather not. I mean, is there a danger saying, well, I'm not sure this is going to be safe for me?
So they would never use... they would never test it on humans like that. They would, the alternatives are to test it on human tissue or human cells, or to use, we can talk about this later, or to use in silico or AI, or to just frame the questions very differently. So, but no, it's never, either test it on an animal or on a.
No, I didn't mean that. I mean, it's gone through, cell line testing or whatever it might be, and it's passed those with flying colours. And they're saying, well, there comes a point where we do have to test it on humans.
Yeah, I see what you mean.
Who have to volunteer.
Yeah.
And are they going to say, hold on a minute? They may feel that, there's no, as you say, there's no rationality to this. But nonetheless, it is that sort of safety blanket of thinking, oh, well, at least it's been tested on animals. It probably is going to be okay for me. I mean, that's probably is embedded as well. Sorry.
They're understandably cautious because they're the regulators.
Yeah.
And, they don't want anything to go wrong. But the trouble is, until we can get confidence in non-animal data, that's never going to change.
And that presumably is one of the aims of the trust, isn't it? To get this thinking changing.
Yes, to get the thinking changing. Because, really, if you're just used to seeing animal data, then you're going to be a bit sort of cautious about data that's come from human tissues and human cells. But yeah, like we've got to break out of that vicious cycle. And of course, that relates to, how much funding goes into, developing non-animal tests, human biology-based tests, and, validating them and, getting them out of the laboratories.
Are there any countries that do encourage non-animal testing at the moment?
There are some countries that are doing better than others. So the Netherlands had an ambition to phase out the use of animals in safety testing of chemicals and medicines by 2025. And they set out this ambition in about 2016, but it met so much opposition from scientists that they quietly abandoned this deadline. But they are still working towards a transition. And also in the United States, similarly, the US Environmental Protection Agency had another ambition to phase out the use of animals in safety testing by 2035.
Oh.
Again, that deadline was quietly dropped after a lot of opposition from people using animals in science. But again, they are doing a lot of work to try and move this transition. We don't have something similar in the UK, unfortunately,
Right.
but people are definitely pushing for some sort of roadmap for this transition.
So the resistance is mainly amongst the scientists, it seems.
Absolutely. The public are on board. You know, there are lots of independent surveys in the UK that show solid support for a move to human biology-based testing and away from animal research. But yeah, it's difficult because there are organisations that exist specifically to, continue doing animal research and encouraging people to do animal research. So, and of course there are all these sort of entrenched sort of lock-in, like animal research, the numbers just increased and increased with the rise of the pharmaceutical industry until in about 1970s there was reached almost 6 million in the UK. It has come down since then, but it's very much embedded in our institutions, in our universities, in our departments of life sciences, medical schools. And because people's careers and their PhDs and their departments depend upon it, it's very difficult to make this transition, even though evidence suggests we would all be better off for it.
I mean, it all even starts at school, doesn't it? I mean, when you do biology lessons, you have to dissect some animal and usually pass out in the process. But that's often part of it, isn't it? So it even begins then. The idea this animal is a thing that you can test and tear apart and things. And I suppose the sort of public reaction, I mean, yours is a science-based one, which obviously has to be the way to go. But of course, the public will introduce the added complexion of the moral complexion that it is cruel. And as you say, well, I said unnecessarily cruel if it serves no benefit at all. And I know there have been a few labs that have been raided, haven't there, where over the years, which have been openly animal testing, and people have tried to stop it that way. But it's through sheer anger and compassion for the poor animals. But you're adding the added dimension of saying yes, and it's bloody useless anyway.
I mean, it changes that ethical argument from a necessary evil, all the ethics around that, to an unnecessary evil, which you have really very little basis for pursuing it, really.
Could you? I mean, you mentioned some stroke medication which you encountered when you were a student. Can you give a few ideas of some of the drugs that you feel are dangerous that have been past the animal tests that are in the market? Are you aware of any?
No. I mean, first of all, I should say that not all animal research has been a complete failure.
Okay.
No, there are some advances that are associated with animal use, and if the argument that we make at Safer Medicines is just that it's just not a reliable method.
Right.
So occasionally it might work, but it can't do it consistently or reliably, and for that reason, it's not a successful paradigm. You need, for a good scientific paradigm, you need to be able to rely on the method. Whereas when animal research is associated with success, it seems to be random rather than due to some underlying theory.
But they say that biologically, I mean, it doesn't say much for us, but we're quite close to the rat, and that they've tested on rats, and they say these results can be replicated in humans. But even with this, you feel that is a fallacious argument.
I mean, of course, we're similar to rats in some ways, and we're similar to bananas in some ways. We're similar to chimpanzees. The genetic similarities are, strikingly similar across the species, and the issue is nobody's denying that. The issue is we need to look at the differences. So even if they're tiny, there are very small genetic differences. They're really important because how those genes are expressed in living organisms can have a huge effect in terms of the outcome, and that's really important in, you know, when you're developing drugs.
Yeah.
Because the outcome can be so, you know, so huge or catastrophic. So even tiny differences can have huge, significant consequences.
Yeah, I mean, I was doing a bit of sort of research this morning, and came across this study, and it's quite common to find these things where, for example, they fed sprouts to different sort of generations of mice, and found even after they injected them with IBD, whatever they did to generate the colitis and other problems, those who ate the sprouts were actually better off, and their gut microbiome was stronger and could withstand Crohn's, colitis, IBD, and the rest. And now the researchers, I'm sure, if they were sitting here now, would say, look, I think we found something quite useful and valid here, that these food groups actually help small children to prevent them getting IBD later in life. And we can't afford to test this on humans because we don't get the funding that the drug companies pour in to prove their own drugs. So what can we do? And in these cases, which we're not testing drugs, it isn't necessarily a cruel thing, but you're still saying no, but the scientific argument still holds that you cannot replicate that in humans, and that even if this was beneficial to the mice, it isn't necessarily going to be beneficial to humans, I assume would be your response.
I mean, yes, we will never know until it's, tried in humans, because, it may produce exactly the same findings, but it may not. And that was just coming back to the point about it not being a reliable method.
Yeah.
Yeah.
So okay, so let's imagine we're in a world now where there is no animal testing. What else? I mean, now, of course, we do have AI, and I don't know what role that would play in drug testing going forward. How do you see the world looking without animal testing?
Well, yes, in silico AI, these computational methods are really important because, they're so much cheaper, they're so much faster. You can feed in information that we have about drugs, all the information that we have, about the human reactions to drugs, and then get information about certain classes of drugs. And in fact, we can then, and they are already being used to look at how certain drugs will, react in humans without having to use animals. So we've got a huge amount of data that once you feed them into these models can be incredibly useful. And as I say, really fast.
Yeah.
And much cheaper, and obviously much more ethical. But in addition to that, we've got fantastic approaches that are based on human tissues and cells, like organs on a chip. I don't know if you've heard about those.
Right. Yeah. Yeah.
So they're these tiny sort of microscopic chips, like the size of a memory stick, computer memory stick. And they've got these tiny little channels, and you can line these with cells from a human organ, and then you can introduce, media and air. You can basically just recreate the environment of the human body, so it's sort of home from home for these cells. And then you can test drugs on these. And in fact, they again are being used, and they have been. There was a great study done last year which actually used them to test the toxicity of drugs that had passed animal tests and were shown to be safe in animals, but then went on to cause, sometimes fatal and serious adverse reactions in humans. And they far outperformed the animal studies in terms of predicting this toxicity. So imagine if they'd been used rather than the animals, how many lives would have been saved. And
and these things can produce a systemic response, so any part of the body how it would react to this drug being used.
So there is a sort of holy grail of having a human on a chip. So you have all these different organ chips. That is some way off still.
Okay.
So there's certain difficulties with doing that and sort of connecting up the different organ systems. But what you can do is combine organ chips with the in silico methods, and you can use all sorts of human biology based approaches in various different combinations, which make them very powerful and which will give you information that can start to approximate the whole living system. So
and where are we with that? Are they starting to use these methods now?
Yes, absolutely. So they are already being used. The trouble is that because animal studies are still being seen as the gold standard, they're used alongside animal studies a lot of the time rather than instead of.
Right.
I mean, this may just be a sort of transition period that we have to go through,
Yeah.
Nothing happens sort of quick. It's not going to be a revolution.
No.
But,
no.
This may just be one stage that we're going through.
But if they do a sort of double track thing, one with animals, one with these sort of special cell line things, and then the next stage, the results are replicated in the humans using this new technology rather than the animals, that sort of starts to prove, oh, this actually is useless.
Yeah,
and
well,
it'd be nice to see that run in parallel, wouldn't it? So people would actually test the testing.
Yes, the evidence is accumulating, though. It is building more and more over the last couple of years, which has, it's really showing the potential of these new methodologies. The trouble is, it's just that so much funding continues to go to the animal studies. It's very hard to realise the full potential without the funding, and also because regulators still keep approving animal studies.
Right.
It's tricky.
So yeah, you're a slight vicious circle, but one that's got some breaks in it. It seems to me.
Yeah.
So hopefully that's the case. But I mean, I suppose ultimately, is it about education? Because if the scientists and I suppose the drug companies too are entrenched in their thinking, is it education to show the scientists the science, which they seem to be kicking against at the moment?
That's a part of it, but evidence on its own is never enough. We're social creatures, aren't we? We're economic creatures as well.
Yes.
Evidence exists in that social and economic context, and so evidence alone, unfortunately, will never be enough, even though people think, oh, well, they're rational scientists, they just need to look at the evidence and then they'll change their minds. Well, it's hard to do it if your living depends upon using animal research, I guess.
But how active are governments in this? Because they would it would appeal to the electorate, wouldn't it, if they stood up and said, look, we're planning to stop animal testing, we're going beyond revising A levels, and we're actually going to do something about animal testing. And I think a lot of people would be behind that. But it may be an emotional argument, but in a way, that's another way in, isn't it?
I think, that people are lobbying MPs and they are lobbying policymakers and governments. I mean, really, in terms of a government taking a lead, again, we go back to the Netherlands, which does have a government program for transition, but we don't have one here.
No.
And we do need one, because although there are all these bottom-up sort of initiatives, you do need a sort of top-down leadership role.
But I mean, I don't know how high up you have to go to achieve the top, whether it is government or whether it is the drug regulators who would be prepared to impose this.
It's not just the drug regulators, there's the whole regulation governing animal research itself.
Right.
Which is supposed to protect animals, but in fact, it just, according to this regulation, animal research should only be done as a last resort. So only when it's absolutely necessary to use animals, and you can't do the research any other way. But of course, we know now that we can do the research in other ways, but the regulation hasn't caught up with this, the evidence and the new science.
So can you just go back on that point again? You say this is regulation that there should be the least amount of cruelty to animals, that animal testing should be a last resort. So which regulation is this you're talking about?
So it's not the regulation of drugs, this is the regulation of animal research. So if people say I wanted to test a drug on animals, I would have to go through several stages, the end part of which is applying to the Home Office for a license to conduct animal research.
Right.
And in order to do that, I would have to show that I was complying with the 3 R's. So that's the reduction, refinement, and replacement of the use of animals in research. Refinement is about refining procedures so that they cause the least suffering and harm. But I'd also have to do a harm benefit analysis and show that, you know, the harms were justified by the outcomes for humans.
I've seen and heard, and it's quite stomach churning, really. I don't believe that happens, does it? Are animals really being properly treated and safeguarded?
Well, I mean, the best way of safeguarding them is not to do the research. And
Well, indeed.
yeah, the fact is that a lot of studies are being approved that shouldn't be approved. But
Right.
for the studies that do use animals, even then, yes, there aren't the you know, the necessary. There aren't always the necessary procedures to try and minimize suffering. So, for example, there's although anesthesia is used most of the time, there are cases where analgesics aren't given after surgery when they could
Right.
easily minimize that suffering.
Right.
So,
And
yeah,
also, you mentioned that, you know, animal testing should be a last resort, but it's not, is it? It's the first resort.
yeah, absolutely. So the regulators are not sticking to their own principles, unfortunately. No.
But why is that? Is it a funding issue again? Are they getting funded by the pharmaceutical industry, or?
No, they're government. They're you know, they're part of a government body called the Animals and Science Regulation Unit.
Right.
The trouble is, there's only about 20 inspectors for the whole of the UK. They
Right.
have very little time. You know, they're not up to date with the new science. You know, the non-animal science.
Right.
They are mostly vets, so their expertise is in animal welfare. So they will generally pass these studies, but try and minimise suffering.
Right.
So, whereas, you know, if we could just stop approving these studies, we'd minimise the suffering anyway.
But there's an enormous conflict here, isn't there, between what you just said and what happens in real life? That you said that it should be a last resort when, in fact, it is a first resort. There is no other option. Everyone does it. So surely that is this is enshrined in law, is it?
Well, the Animals and Science Regulation Unit, yes, is actually, you know, given the task of approving animal studies according to certain principles. But yes, according to law, it should only be done as a last resort, according to the EU directive, which
Right.
is 2013, yeah, and which we've retained since Brexit. It should only be done if there's no other way of doing it, and if the harms are justified by the benefits.
Wow. I mean, well, surely, you know, they could step in here and do something more than they are. It sounds like it's not being properly administered at all.
No.
But anyway, Molly, how are we doing with questions? Do we have a?
Okay, I'll just go ahead and ask the question. So someone has submitted, it was my understanding that drugs had to be tested on a rodent species and a non-rodent species. Is that correct? And does that make a difference?
I have to confess, I'm not entirely confident about answering that question. I think that certainly was the case, that it had to be tested in a rodent and a non-rodent species. I think there is an option for that not to be the case now, but I'm not sure whether that option is taken very often.
So more of a statement, but I'll read it.
Yeah.
They've said, as no one can tell if an animal test will be applicable to humans, surely this means that humans are the ultimate animal.
Humans are what? The apps?
The ultimate test animal. So as no one can tell if an animal test will be applicable, surely that means humans are the ultimate test animal.
Absolutely. That is the outcome of it, yes. We don't know what will happen until it's tested in us, really.
But then I mean, we're right. That's a good point. But of course, the problem is then people are not going to be rushing forward to volunteer if they feel like if you're the first person who's going to test this.
Well,
so
they might rush forward if the preceding tests gave much more confidence, which they would if they were based on human tissues.
Yeah. Okay. Okay, that's good point. It's education again, really, isn't it?
Mm.
Any others, Molly?
Yep. So someone said, could it be beneficial if, well, it would be more beneficial if a negative side effect was to happen on the animal first? So,
yes, if there is a negative side effect for the animal, then it's that drug won't be tested in humans. Yeah. So the trouble is, then you've got the opposite problem. It could be that that drug might be useful for humans. You know, and we won't know because it was eliminated from the testing process because it was found to be toxic to animals.
Same problem in reverse. Yeah. Okay. Yeah. Okay.
Someone's asked, you touched upon AI. Can you explain a little bit more about that and how that would work as an alternative?
I'm not an expert in AI.
No one is.
No, I'll give it a go. So yes, let me just there was a really nice test that was done. Let me just, if you don't mind me just looking at my notes, because I'm
No, please do.
Very bad at remembering something. Yeah, so one of the adverse drug reactions is an irregular heartbeat or arrhythmia, and so that's something that people, you know, look out for when they're testing a new drug. But there was a human in silico trial. So basically, you know, I was telling you that you feed all this information into computer models. And 62 drugs were tested on computer models of human heart cells. And the model was able to predict the risk of drug-induced arrhythmias with almost 90% accuracy, which compared very favorably with the animal studies. As I was saying that, I'm just thinking that's not AI, is it? Because AI is when the program is actually learning from the data it receives.
Yeah, machine learning as it goes. Yeah.
It's not actually just an in silico model. So I'm just trying to think about a good example of AI. I suppose it's really that the more information that we feed about human drugs and human reactions to drugs, the more it will learn about those, and the greater accuracy the predictions will be. Sorry, I can't answer that question very fully.
No, but I think you have. I think you that's exactly what AI is. It's machine learning, and if you can feed in all the compounds that are used in pharmaceuticals and trace through what reactions there've been to those, it's going to build quickly build a picture. And the more you ask the questions, the better the answers will become, hopefully.
Yes, over time, definitely.
Yeah, and quite quickly. You know, I think really in a matter of months, but you have to have that decision to start using it for that purpose, and it will start building that picture.
Yeah.
Yeah. Okay, Molly?
Everyone's a bit shy today.
Oh, okay.
Oh,
well, everyone sort of agrees. I mean, I think we're all. I mean, to be honest with you, Pandora, I've been rather surprised by a lot of the things you've said today, because you know, I think that the fact that this regulatory group exists to care for animals, and that animal testing is meant to be a last resort, and clearly that doesn't happen, and the entrenched ideas of scientists who are essentially kicking against science, I find quite extraordinary. And that you'd think, well, surely to goodness, I still, I mean, the driver is, I suppose, surety, isn't it? Is saying I need to get the amount of money they're spent developing this drug, so let's take the easy, recognized route through here to get the drug to market, and that's always going to be through animal testing, irrespective of the accuracy of the results. So in that sense, by that point, it's already being driven by money more than by science. And I think that's one of the things you probably do encounter in the trust.
I think it's driven by money, but also, custom and practice is driven by caution on behalf of regulators. Yeah, I mean,
it's not caution, is it? If it doesn't do any good,
yeah,
that's not being cautious. That's being irresponsible.
Yes, so they're just cautious because it's the new science. They're
You're
familiar
doing
with
something differently.
the
Yeah,
animal data. But
yeah,
again, what it comes down to is that science on its own isn't going to change things, because my background is a social scientist, so you know
you understand this better. Yeah,
we're social creatures, so
yeah,
we're very much affected. We're not that rational, and so it doesn't just do to show us the science and think, right, we've got to change everything. Unfortunately, we've got, it's now in animal research is embedded in regulations, in institutions. People's livelihoods depend upon it, and these are the factors that we have to tackle as well as the evidence. So there's lots of different
yeah.
levels really before a transition can take place.
Yes, I can understand that. I mean, I started the conversation by talking a little bit about the previous webinar. I know you won't want to get too involved in this, I'm sure. But I mean, the COVID jabs were rushed, weren't they? And it was a politically expedient to show that you were doing something in the face of this epidemic. And there's no doubt that, a process that normally takes 10 years, which took 10 months, corners had to be cut. There's no way around that, and including the safety ones. And we are seeing, quite high levels of serious adverse reactions to these jabs. And you think, well, there you are. There's the proof that these passed the animal trials, and yet these have been traumatically dangerous for some people, not for everyone by any means, but a very small minority of people. But nonetheless, it has been. And we're just the tip of the iceberg. I mean, the first 75 claims have gone in. There'll be many, many, many more. And you think, well, here we are. Is proof positive that this technology that was tested on animals is actually is seriously harming humans.
Well,
And yeah,
I'm probably going to shoot myself in the foot now, but in fact, the animal tests that were done for the COVID jabs were a lot less than would normally be done.
oh, okay. Yeah. Okay,
So,
maybe you're arguing against yourself here a bit, but
so as you suggested, I probably don't want to get into this too much because I don't know enough about the whole COVID thing.
okay.
Apart from
But nonetheless, Pandora, there were animal tests, weren't there? And maybe not to the extent they normally would do, but there were. And
yeah.
it told us nothing.
Well, a lot of them were done in conjunction with the, in parallel with the human trials, because they wanted to get it into humans as quickly as possible.
Indeed.
So that's slightly different to what would normally happen.
Yeah, indeed.
Yeah.
Okay. I mean, are there more questions, Molly? Because if not, I'll talk about this a bit more. Because what can we do? It is it. You're very right, Pandora. I mean, it's a complex thing to shift because of human behavior and groupthink and all the rest of it. You're absolutely right. But what more can we be doing can we spread the word more, whether it's what doctors or anybody? Because it seems to me that education is an important part of it. And maybe the new generation of doctors, maybe at training school, I don't know, need to be shown this evidence more, and be encouraged to recognize that this is a hopelessly inadequate way to test. I'm just wondering if what can we do here? Can we do more to move this along a bit quicker, do you think?
I mean, one thing that would be really important is to try and put pressure on funders, because they're just continuing to fund studies, for example, in stroke, that haven't produced anything in decades. And it's sepsis, for example.
Right.
No treatment for sepsis, a leading cause of death in hospitals.
Yes.
Huge amount of research on animals, hasn't come up with anything. Alzheimer's, continuing to.
Absolutely.
So I think one way we need to sort of try and get more funding away from animal research and towards research based on human biology. But I think some other really exciting things are the approaches that look at early detection of disease, because a lot of animal research is trying to model disease when it's at a very advanced stage of
Yeah.
it. You know, by the time it's very hard to turn it back. You know, like Alzheimer's has been going for 10 years or so before it, you know, appears in a symptoms. So if we were able to get to the very earliest signs of Alzheimer's, we'd stand a much greater chance of intervening successfully and non-invasively. And I think there was something in the news just last week about a blood test that was trying to look at the sort of very earliest footprints of Alzheimer's by looking at the leakage of some of the proteins from the brain.
Yeah, yeah.
I think these are the really exciting things. You know, they don't go anywhere near animals. They're entirely based on humans, and they would give us a much greater chance of intervening when there's time to intervene and change the course of the disease.
Yeah.
So that's the exciting way I
Very
think
good.
we can go.
Well, Pandora, thank you so much for the conversation. I mean, I've really learned a lot, I must say, and I really thought it was much more to do with you know, a compassionate argument, an ethical argument. It really isn't at all. So it's been absolutely fascinating. Your book is wonderful, by the way, which I think you should grab copies and grab a few copies and make sure all your friends read this essential book as well. I mean, Pandora is a first-class scientist. She's really done her work, her research here, and it's very well worth reading. I mean, we were quite blown away by it ourselves. So, and in the meantime, do read the extract from the book in the November issue. It's very well worth reading. Pandora, thank you so much.
Thank you, Bryan, for inviting me. I've really enjoyed our conversation.
Have you? Well, I certainly have, and you know, but we all have an awful lot to learn, and I think you've really widened the whole debate into an area that hopefully would speak more to scientists, or should be speaking more to scientists who are meant to be scientific. But we'll get there eventually. They're also human beings, as you rightly point out, and that's part of the uphill struggle. I mean, and just finally, you mentioned funding, but of course, the pharmaceutical companies are the funders, and maybe
and governments.
To an extent, that's true as well. Yeah, but maybe it is about people feel very strongly about this, and people move things because they care about the you know, not being cruel to animals, and maybe, you know, shareholders or whatever it might be can start lobbying the drug companies to say, let's do less animal testing. You know, and that could be another way in. I don't know, but I think that we need to sort of really think this for a bit of creative thinking here to see what more we can do to shift this argument, because it's absolutely essential that it is. So, Pandora, thank you again so much.